growing call to remove fluoride from public drinking water. Secretary of Health and Human Services Robert F. Kennedy Jr. claims it causes health problems, but medical professionals disagree. Adding the mineral to tap water has long been considered one of the greatest health achievements of the 20th century and credited for helping Americans preserve their teeth. Adding it to water has been a law here in Illinois since 1967, but Utah could become the first state to ban it. Joining me now to talk about this, Dr. Scott Tomar, professor and associate dean for prevention and public sciences at the UIC College of Dentistry. Thank you for being with us.
Oh, it's my pleasure.
So what are your thoughts on this issue? And for those who might not know, how does fluoride benefit our oral health?
So fluoride is effective for preventing tooth decay. We've known this now for about 80 years. Really, the beginning of community water fluoridation started in 1945. It's effective even at a time of widespread use of other fluorides like fluoride toothpaste. We still have about a 25% reduction in tooth decay associated with the use of community water fluoridation.
Interesting. Are there risks that come with avoiding fluoride altogether, especially long-term when it comes to our kids?
So the primary risk that would occur from avoiding use of all fluorides is an increased risk for tooth decay. We've seen this in several communities recently that have stopped fluoridation in Calgary, in Canada, in Juneau, Alaska, and actually in Israel. When they stopped fluoridation, they saw a pretty rapid increase in the rate of tooth decay, especially among children in those areas, and the associated costs related to that.
Okay. What is your recommendation for parents who might feel a little confused about what they're seeing online and the discussion about that versus what their dentist is telling them?
Unfortunately, there's a lot of misinformation out there. The reality is that fluoride in the forms that are available on the U.S. market, both things like fluoride toothpaste, fluoride mouth rinses, and including community water fluoridation, are all safe and effective as used. There is no adverse effect associated with the use of these forms of fluoride if they're used as recommended. With water fluoridation, again, we've been using it for 80 years. There is no evidence of any adverse effect associated with drinking fluoridated water. With toothpaste, what I advise for young children, first, the parent should be brushing their teeth for them until they're about age 6 or so, when they have the ability to both handle the toothbrush by themselves and to spit out the excess toothpaste. But for young children, we recommend using a very small amount of the toothpaste, again, applied by the parent or guardian.
Dr. Scott Tomar with UIC College of Dentistry, thank you for that information and your time.